All right, we are live. It's 8:01 p.m., so we're a minute late. But if you know my mom and I, we're both late a minute or so to everything. Bear with me just a second here because I want to take this link and put it on my mom's page. But mom, how are you otherwise?
I'm well.
Yeah?
I
How
am.
was your day?
Hectic.
Why was it hectic?
It was hectic because there was a few emergencies with people I'm working with.
Okay, no problem. Just buying time. Again, everybody bear with us because my mom, I want people on her page to see it. All right, let's try that again. Hello, everybody. It is now 8:01 p.m., and welcome to the very first episode of Dr. Mom. Here we go. All right, what's everybody? What's up, everybody? Welcome to the very first episode of Dr. Mom. We are here with my mom, therapist, lawyer, and mom. Mom, how long have you been a therapist?
40 years.
Yeah? Where'd you go to school? Give everybody a little bit of background. It's your first episode.
My bachelor's at Temple, my master's at Penn State main campus. Then I came back to Temple for an advanced certificate. Then my doctorate at Temple and my law degree at Temple.
Do you think you're special?
Do I think I'm special? Not at all.
I'm messing with you. And then where did the whole law school idea come into play? Let everybody know how you get decided to become a lawyer because you did that a little bit later in life, right?
A little bit. I decided to become a lawyer because at the time the insurance companies were leaning towards HMOs, mangled care, we call it. And I wanted to do some advocacy work so there would be better accessibility of insurance to all kids and all adults. Haha, we saw where that went. The HMO still came in and took over.
All right. Well, I'm glad you got it done. How many times did you have to take the bar? I mean, it's not that embarrassing because you were already a therapist. So I mean, it's one thing to be a therapist and go to law school. You're allowed to fail the bar a couple of times.
I didn't fail the bar in Jersey ever. I was past the bar the first time in Jersey. But I had heart surgery. Well, you know what? It's interesting you're asking me that
Mm-hmm.
because we want to do this podcast on special needs. So I wanted some extra time on the bar because on the Pennsylvania bar because I had heart surgery during my last year in law school, and they gave me a hard time about getting the extra time. Once I got the extra time, it was fine. So that was that saga. And it's really not fair. We'll see when we get into a little bit of our show tonight when kids need some accommodations or adults because of some disability. There really shouldn't be all this fuss given and all the hard time. So I'm a big advocate and champion for everybody to get what they need.
Yeah.
And,
Well,
and
you and I have always butt heads on this, so we'll talk about that a little bit. But I think I've outgrown that because you and we'll talk about this a little bit right now. So you took me to get tested for ADD, I believe it was when I was like 8, 9, or 10 years old. And let me just clarify that right now, everybody. Tonight we're going to be talking about ADD, ADHD, and autism. So a little bit about how it's diagnosed, a little bit about how it's misdiagnosed, and then of course my mom's input. And you can ask questions along the way. We have the chat available. I can bring the questions up on the screen for the doctor. So here we go. So, mom, the first thing I was thinking about on my way over here as we were talking, or I was thinking driving up here from Pennsylvania or back home from Pennsylvania, was I was diagnosed with ADD at a young age. I remember the test they gave me, one of them was I had to sit in front of a screen for a half an hour and hit the button every time the screen blinked. In my opinion, anybody would just be easily annoyed at the fifth minute. So have we gotten better at diagnosing ADD? Have we learned to maybe fix a few things as far as the testing and the diagnosis? Because you and I have talked about this, and like I just said, there's some parts that I don't believe are fair. Like I think anybody would lose their mind with some of these testing that declare or diagnose somebody with ADD. It's like you're looking for me to lose my mind. So is ADD still a thing also? So I gave you two questions. One, do we do anything different with the testing? And two, I'm not sure I hear about it as much anymore.
I'm often envious. I hope some medical doctors are listening because they have images, x rays, cultures, things that are definitive. But in psychology, there's nothing definitive. There is no definitive test. You can get an IQ test, for example, it can show some patterns of ADD, but even an IQ test isn't definitive. So I'm old enough that back in the day, there was something called a quote unquote college counselor. She looked at your IQ. She said, "You're college material, you're not." But guess what? It didn't hold up. Some of the people she said you're not excelled and did well. So, as to your question, psychology is a lot, just like medicine is art and somewhat science. But like I said, they have images and definitive tests. We don't have anything like that. Have we gotten better at diagnosing? I think there's more early intervention, which is important. With any disability, with anything like ADD, ADHD, or autism, early intervention, early diagnosis is better. I don't know if they still use that test. The test that Ryan's talking about is part of a neuropsychological examination. But I think we've gotten better to look at multiple factors across a child's performance, not just one factor, if that makes sense. So we're going to look at school performance, home performance, behavioral, social, language development, sensory motor development. There's multiple facets now to the diagnosis. I think you're still young, but 20 some years ago, I think it was more of a linear process. It's more of an overall systemic, multiple factorial process today.
Yeah, I remember it was like ADD, ADHD, Ritalin. There was like no in between. It was like if you had ADD or had ADHD, you take Ritalin, right? And one thing that sticks out to me, and then I'll let you speak. I'm sorry. One thing that sticks out to me is South Park actually touched on this somewhere along the way. They did an episode where all the kids they were giving them all Ritalin, all right, and one doctor comes along and he speaks very well and he starts saying about how he found the cure for ADD, and then you see a bunch of kids bouncing around in a classroom and he walks around to each kid and he goes, "Sit down," and the kid sits down. And he goes, "Do your homework." And the kid does his homework, right? So they're pretty much saying that why do we need Ritalin? Why do we need medication when discipline and structure could, in fact, be the way to overcome these things? And I want to give you a chance to speak on that because remember, for a long time, you and I butt heads. I said, Alexis doesn't have this, Alexis doesn't have that. Now, we love Alexis with all of our hearts. She is a jumping bean. She always has been. She's active. Her mind goes 1,000 miles a minute, just like me. And, she's like this with school. She's like this with her grades. Then we put her in tech school and it's like, right? So she's hands-on. She's discovering something that she may want to do earlier in life, earlier than I did. And, vocational school is a huge thing right now. So I'm sorry, I'm going off on a little bit of a tangent here. But what has changed from medication to possibly discipline and structure, and what would your advice be now with ADD, or is it still go talk to your family doctor or your psychiatrist and let's look for some prescription medication?
I don't think there's one recipe for everybody. You have to take it always on a case by case basis. And that's what psychology is and prides itself on the study of individual differences. But you have to think about normal and then when it goes out of the bounds of normal. So let's look at ADHD for a minute. One of the diagnostic criteria is impulsivity. Now, here's the thing. Do you know, many, you have a 4-year-old. Is she impulsive sometimes?
Every
Of
second of her life.
course. But we have to see maturation wise, developmentally, is she going to outgrow that? Is it going to start to simmer down? And is she going to cross into a line where the impulsivity is out of whack for her age developmentally? And that's when you start to think about a diagnosis. If you're asking, do we overdiagnose? I think so sometimes, but sometimes I think we underdiagnose. It depends on the family. Some parents are resistant to any label. They worry, hey, doc, what if my kid wants to run for senator one day? Is there going to be a label that they had ADD or ADHD? I say, don't worry about it, because every politician had some kind of ADD or ADHD, or else they won't want that job, because anybody, with a regular disposition would never want that job. So I don't think we need to really worry about that. But it's about crossing the line into behavior that really puts the child at some risk, that has some developmental delay where they're not catching up. So, for example, from your 4 year old to your 15-year-old, there's a lot of changes, right, in impulsivity. Alexis, your 15-year-old, has more ability to self regulate than your 4 year old. So, we have to keep our eye developmentally as the child's progressing. But where they get stuck, where it's not catching up to their age appropriate behavior, then we start to evaluate, along with a lot of other things. Where's the child academically? Where's the child in their social development? Where's the child in their language development? I do get annoyed when people don't realize how much science there really is in psychology. And like I said, it's a multifactorial approach. So it's not that we want to stick a label on anything. But here's the rub: if you don't catch it at the right time, then the child is going to really have gaps in some of their learning. So if they can't sit still and they can't concentrate, and there's some major concepts that they have to get, sometimes we do have to rely on medication because they just can't focus or concentrate without that medication. One great thing about what we call psychotropic or psychological medication is that the proof's in the pudding, so to speak. So if you give the child the Ritalin and you see an amazing difference, then what? Then that speaks to that diagnosis, doesn't it?
Well, I'm
Right?
gonna say something, huh?
If you see a major improvement, then it's more criteria that they did have that diagnosis.
All right, so let me say this. Sorry, everybody, if you're listening. She's also my mom, so sometimes I talk to her like she's my mom. So first thing, Jade is impulsive, 110%. There's no denying that. She goes 100 miles per minute, right? Here's the scale. Everybody can see. Here's the scale, all right? Jade, 100 miles an hour when she's at home, impulsive, all right? Here's the scale. It's over here a little bit. Her teacher tells me that she gets upset if the board isn't changed, if structure is out of whack, if the routine is out of whack. So even though I'm going here with her behavior, I'm here because she acts like this at school. Like I'll take that as a parent of a 4-year-old. I'm not, I'm not like, okay, well, let's start talking to a therapist. Let's start talking to the doctor about medication or anything like that nature. So I'll take the structure or how she gets upset in a classroom setting, or maybe not upset, but a little disorganized because she wants to make sure that the structure is there. And then I'll work on things at home, if that makes sense. So I'm okay with me having to do my part as a parent where I got to kind of reel her back in. I'm not upset when I hear that she's not really the same way at school, that she likes the structure, that she tells the teacher that the board hasn't been changed. Like I'll take that and kind of see where things go, if that makes sense. I'm not jumping to Ritalin or medication right off the bat.
Okay, but you're disciplined. You have a lot of discipline. You work out, you have a structure, you're disciplined at work. So if you're asking me, which I think is a really good question, should parents try everything first before jumping the gun on a diagnosis, before medication? Absolutely. Is there any child that doesn't benefit from structure and discipline? Of course not, right? But I'm just, one of the reasons I wanted to do the podcast is to raise awareness. If Jade's behavior was disrupting the whole classroom, if no matter what you tried at home, she's still disrupting the classroom, then that's another problem, wouldn't it be? But if you're saying try everything at first to have a stable environment with discipline, that I absolutely agree. That isn't the reality for families, though, is it? We have, both parents working. We have kids on electronics. We have exhausted parents. So that's a question we have to look at. Do we overdiagnose sometimes because the structure and discipline isn't in the family? And that's a possibility that I, as a psychologist, and I'm sure my colleagues are always thinking. I'm conservative about medication, whether it's a child or an adult. Still chemicals. They still have side effects. Has anything changed since you had Ritalin? Of course. And the medications get better and better with less and less
Yeah,
side
everybody
effects.
ended up doing heroin instead.
People did end up with a opiate problem, but that's
I'm
another conversation.
smiling, but I mean it. I mean that's one thing that I've talked to you about. I said that in your 40 years of being a therapist, and then I'm going to start addressing two of the questions that are over here on the quarter. I said in your 40 years of being a therapist, when you started treating kids that were my age, it was Ritalin. Then it was weed, maybe. Or I don't like to use marijuana as an example because we're starting to migrate into a new era, if you will. But there was the opioid crisis, right? So did we inadvertently create the mindset that medication or something of that nature is the solution to all of our problems? And did we perhaps medicate too early back in the mid 90s, late 90s? Because I don't
You
hear
speak.
about Ritalin anymore. Maybe it's out there, but I haven't heard about it in years as far as kids using it.
Oh no, it's still widely used. Are you asking me? Are we a drug seeking for solution
That's
society? Of course,
absolutely what I'm asking you. Yep.
absolutely. There's a drug for everything. So if you're there's Viagra, there's diet medicine, there's ADD medicine, there's depression medicine, insomnia medicine. What isn't there a medicine for? And there's nothing wrong with the medicines. We just have to get back to a last resort. Are they prescribed too easily? Listen, half of the time, the medications for children, you know who they're prescribed for? Not for the child, for the mother, because still primarily mothers are raising the kids. So the mother goes to the pediatrician exasperated, and the pediatrician sometimes, I'm not picking on pediatricians, they don't know what's going on. They don't have the time to spend like mental health doctors do. You're not there with them for 15 minutes like we are. They have a cursory view of how they're disciplining the kids, and so they try some medication. But if we got back to that, it was the last resort, everything, a checklist, and everything is tried first, then I'm much more comfortable with it. Because sometimes you're right, with behavioral intervention, sometimes we can change the child's acting out behavior. So, yes, I think that it's drug seeking. Do you ever watch the TV commercials at night? If it's like midnight on, there's a drug for everything from midnight on. That's
No,
what all
I
those.
just I've seen it with the people I work with over the years.
But right,
I'm
am I
I'm, I'm
right?
half joking, but I'm serious.
No, what isn't there a drug for?
No, there's a drug
Right?
for everything.
For
But
mood, for this, for that. You're a workout person, so there's a drug for mood. But maybe they should say first you have to exercise and eat right before you take the drug for the mood. You
well,
see what I'm?
I'm just going to say one thing, and then I want to address Maria real quick. There's still something, even if you work out, pre-workout, a bunch of other stuff that people pump in their bodies, me included. I don't do it too much anymore. But real quick, so there's this very attractive, blonde-haired, blue-eyed young lady who left a comment a couple minutes back. Her name's Monica Stillman Oppenheimer. She said, "I've
Uh,
always been a big fan of structure and being disciplined as a means of keeping expectations consistent for kids." Um, Maybe her and I can work on parenting one night together. She seems pretty cool. I'll end up giving her a call. And for those of you that don't know, that's my wife, Monica Stillman. So, and then Maria had two questions. Let's bring up the
wait,
first
wait,
one.
we go back to Monica for a minute because because
Oh
she's
yeah,
an
go ahead. Go
educator.
ahead.
So Monica, but when do you know when a child in your classroom? What are you looking for when you're saying, hey, this is more than just probably a behavioral issue? So I'd love to know for her as a teacher, what are some of the things, because that will educate all of us. What are the educators and teachers looking for that says, hey, this might be more and require further evaluation to the school psychologist or a recommendation?
Okay, so we'll see if she responds to that. So Maria has two questions. What is the difference between ADD and ADHD? Let's start with that.
Oh, I love that question. So ADD is primarily inattentive disorder. And here's the thing. Is it Maria? Is her person?
Maria.
Right. Maria. Here's the thing that you won't like being a female, because it's primarily inattentive, because young girls with ADD are not punching walls. They're not screaming and yelling. What are they doing? They're daydreaming. How much disruption does daydreaming cause in the school? Almost none. So they're an underserved and underdiagnosed population. So I'm often doing an evaluation of a 20 or 30-year-old woman, and for the first time, just finding out that they had ADD. So ADD, primarily problems with inattentiveness, They're a little developmentally delayed. The typical female, young female with ADD, focusing problems, inattentive. When I grew up, you know what they called her? Scatterbrained,
Real quick, it's
misplaced.
Marla. I'm sorry, Marla. Newlight. I'm sorry. That was Maria. But yes, keep going. I'm sorry.
Misplacing their keys, a little bit scatterbrained, underdiagnosed because they're not behavioral conduct disorders, socially immature, and usually with a lot of social anxiety. ADHD is more prevalent in boys, and it has that hyperkinetic. Everybody knows the ADHD child. And I was thinking, Ryan, before I started this podcast tonight, that when I was in school, there was a boy. Hope he's not listening. A boy named Tommy. Tommy, the teacher could never find Tommy. Tommy was under the desk, over the desk, in the desk. Years later when I started studying psychology, you know what I realized?
That Tommy's a millionaire now.
Probably, but Tommy couldn't read. Tommy
Okay.
had probably ADHD. ADHD can come with some developmental delays in reading. He couldn't read, so he was wound up and hyped up, but we didn't have the labels. When I went to school, there was one way to learn. Everybody had to learn in the same way. Thank goodness for your kids. We know that people are divergent learners. But the primary difference between ADD and ADHD, you're going to see some more of it in girls with the ADD, and you're definitely going to see that hyperkinetic acting out behavior in the boys. And so, therefore, they get diagnosed and picked up earlier. So, this is all through medicine. If you look, not to get off on a tangent, if you look at cardiac patients, because men present with chest pain in a certain way, and women present more with nausea and sweating, diaphoresis, sweating, because they present in different ways. Again, they're often uh, overlooked. So we have to change it up and make sure that female versions of disorders, whether it's a heart attack or it's ADD, that the female versions are given equal time in healthcare.
Okay. I like that answer. So real quick, ADHD, ADD, talking about parenting and how far we've come, and recognizing things, and perhaps diagnosing them earlier, to use the correct verbiage. It's very interesting sometimes in my household because, as great as my teachers were in high school, most of them. I don't need to mention their names. In high school, they took care of me. They got me to the end of the finish line with everything that was going on, me being a young parent and things of that nature. But I pretty much do not have a high school education. Right? If we're being honest, we made it happen. The kids in my particular class setting had their own issues, and we had more group sessions and things to work on. So we never really got around to the academic side of things. And then I get out of high school and I think, well, the next step's college, right? That's what you're supposed to do. I failed out of college 3 times, and I went to go work in a restaurant, and it turned out that I like hospitality. I like being on my feet. I like when things are going 700 million miles per hour. Let's see how that goes. Restaurants turned into hotels. I develop a successful career. I become leader of the quarter. I win manager of the year, right? So then we have my wife who pretty much did everything in order, right? The American dream. She was a successful high school student, successful athlete, went on to college, got her bachelor's degree, master's degree. She is a phenomenal educator. She is consistent. She is always looking to learn. She is in prestigious positions within her school. And so when we go to parents, sometimes it's kind of like she wants to do X, Y, and Z academically, where me, I'm kind of like, we'll just see what happens, right? And I don't mean like, okay, let's just let the kids do whatever they want. But as I have seen, and I'm sure you've seen it as well with myself and other people that I've met along the way, if we didn't do so good in school, it's not the end of the world. And that's why sometimes when Monica tells me about the more difficult students who display some of the things that ADD and ADHD, when they display some of those characteristics, I always say, all right, that kid's going to be a millionaire. Or watch, that kid will be a successful Navy SEAL, something like that, right? And to this day, I catch myself, I catch my ADHD, if you will. It's still there. I'll be at work. There's 100 things going on. One task happens, and then I get another task, and then I get another task, and I want to go to the next task, and I need to catch myself. And this is where discipline and structure from martial arts and being in the hospitality industry with lots of great mentors comes into play. I catch myself. All right, listen, your brain has to be here. Okay. We have to complete this task, then the next task, then the next task. But one of my very good friends who you know, Tim, he has also been diagnosed with ADHD. He was diagnosed at a very young age. He took Ritalin and all that. And he says that he feels like it has made him a very successful kitchen manager. What do you think about that? The characteristics helping out people like myself later on in life.
I think that we have to suspend judgment so we can be a judgmental society. And I think what you're saying is sometimes we judge one form of intelligence over another and don't respect that there's multiple and divergent ways to learn. And if we just could get out of the mindset in this school setting that there's one way to learn, that would be a great thing. So, your daughter, for example, is doing some EMT in high school, right?
Yep.
She's training
Mm-hmm.
for that because whether she got, by the way, ADD, ADHD, and autism are, there is a genetic predisposition. So, yes, I do think that you have some ADHD. Yes, I do think your daughter has some, even though I just said before it's more ADD, but she does have some of the H, the hyperactivity, and she's channeling that positive way. The goal for, and I want to hear from the teachers listen, the goal from the teachers is to respect that there's diversity of learning. There's different ways. It's not more important than the other. I would give anything to have some of the mechanical learning ability, right? But I'm not good with mechanical things. I can
Right.
read a book and retain it. I can do the logic. I love math, but I really have trouble even with a screwdriver and doing simple things. But that intelligence is just as important as any intelligence I may or may not have. So, part one is what do you think about what I'm saying, everybody? Just dropping the judgment that there's one way to learn. Now, here's a problem. And again, I need the teachers to help me out. I don't work in a school district, but I imagine some of this is about money, right? Because it takes a lot of money to have different classrooms. Can we say, oh, we have a classroom for this kind of learner and that kind of learner? I don't know that we can do that financially. So that's one issue. Do I think that ADD and ADHD can drive a career if you find the right match? Absolutely. Like you're saying about your friend Tim. I want to tell everybody a great story. Somebody I was working with asked me to write them a letter. I don't want to say to what university, to a very prestigious university, and they in fact have ADHD. Very good university. And I said, I really admire you. I think you're brave. That this was years ago. I think you're brave because you want to tell the university right out that you have ADHD because they felt, like I'm saying, if the university was judgmental and didn't want them with that disability or label, then they didn't want to go there. Not only did they get accepted, they got a phenomenal scholarship. So I, as a mental health doctor, had to know. And I got permission from the person I was working with to call the university. And I said, you are this university. You can have any student, prospective student you want. Why did you pick one that had this label? Here's the answer. Because they tend to be the most creative and energetic students that we have. So as to your point, absolutely. And it was a great match, and they went on to get a degree and do well from that school. And it's a great story about what I was saying, dropping the judgment and seeing the pool of creativity. I think ADD and ADHD kids are some of the most artistic and talented. You did a show a few weeks back on musicians, right? I bet
Yes.
if we tested, how many of the musicians do you think have ADD and ADHD?
How
I'd
many
say
of
it's
them do you
going to
think finished high school?
not many, right? But they love, but that musical gift is amazing, right?
Mm-hmm. Yeah.
But they don't want that job, that 9 to 5 job. It's funny because the ADD kids say to me in ADHD, Dr. J, I could never do your job. Sitting in a small office talking to people, I'd go nuts. I'd go crazy. I'd have to be outside. I'd have to be moving around. So again, it's not to be repetitive. It's just learning that there's many different ways to learn. But I don't know that that fits the school system because look what we'd have to do if we really took that to the max. Is that a reality? I don't know. Are we really going to, you understand what I'm saying? Really going to
Yeah.
program all these different ways to learn. That's a goal, I think, for teachers in schools.
So I think it's really important for people to note that maybe like a quarter of it is your PhD. The rest is just being Jewish and liking to talk. So that's what really comes into play and help you out in your career. So real quick, Alba, thank you for commenting. Alba heard me going on my little rant, and she said, "Yes, martial arts has been a great help for my son. If you ask me, I tell my mom, I tell anybody who asks me, martial arts saved my life because I was just hyper. I didn't know what I wanted to do, but I still knew I needed an outlet and I wanted structure. I wanted structure. So I was like, let's try some martial arts. And I learned that I wasn't the toughest guy in the room. I learned that in order to be successful, you don't just start swinging at your arms and kicks and things like that. You have to learn to control your body. You have to learn to be smart about it. You have to learn to use these mental tools that are instilled in you through martial arts. So yes, I think martial arts is a great outlet. I think for kids, find the right gym. I think that's important. Just while we're talking about it, make sure that the instructor is somebody who is very focused on the kids and keeps it interesting, just like anything else, right? We don't want to tell the kids to just punch and kick for a half an hour. We need to break it up. We need to do punching and kicking, then let them play dodgeball or something, let them play tag. That's what I used to do when I was working or coaching kids, and I found that it was very beneficial because a lot of the kids, I guess, just thinking about it, I didn't diagnose any of them, but they probably had some form of ADHD because they were, the wiggles when I told them to line up. But yeah, you always find a gym and kind of interview the instructor of the dojo. Make sure that that person really has your kid's best interest in mind. Ask them what their core values are. Really feel them out and make sure that it's going to be a good fit for you and your children. So yes, martial arts is always a big one for me as far as instilling discipline and structure. Let's jump back to Monica real quick because she commented on your question, I believe. So, or I'm sorry, answered your question a little bit. As a teacher, sometimes those types of kids, boys in particular, just need to learn in different ways, like learn through movement in the classroom, allowing them to stand and take a break, etc. Following that, she wrote, yeah, so that's called differentiated instruction. When you get to know a student and their interest, learning style, and prior knowledge, you can differentiate your content, process, and products assessments to meet the individual needs of learning. So before you go ahead and speak to what Monica just said here, I finished the book Extreme Ownership by Jocko Willink and Baf Laban. And the one thing they mentioned a few times in the book is whether you're at the adolescent level, the adult level, the Navy SEAL level, the corporate level, you're a CEO of a big company or whatever, you have to keep everything simple because if you start breaking it up too much, people can start to get lost and get confused. And I'm thinking to myself, if somebody told me, if you tried to break it up so much for somebody with ADHD, like myself in particular, eventually I'd be like, yo, I just don't want to listen because you're breaking it up too much. Does that make sense? Like, I need you to just kind of tell me directly what I need to do. And maybe it's best if I'm not in the classroom with a bunch of students who are able to focus and really just go with the motions in the classroom. I don't know. So maybe there should just be, I don't know, a different criteria for children with ADD and ADHD, and not a bunch of different things like you were implying that a budget could impede on.
But now you're talking about something in psychology they call micro steps. That some people can't break things into big steps and they need small steps to feel some sense of accomplishment. But you touched unknowingly, you touched on something else, which is that ADD, ADHD, and autism have what we call in mental health comorbids. They are disorders that occur with other disorders. One of the most common disorders that they occur with is anxiety. There's a lot in the autistic population, a lot of anxiety disorders. In the ADD and ADHD, a lot of anxiety disorders. So it really depends on the nature of the person. Some people with anxiety, you're right, they go crazy with the small steps. They want to see the big picture.
Mm-hmm.
Again, you have to take the whole picture, the composite picture, see what the comorbid conditions are because they usually are co-occurring disorders. It's I haven't seen that many kids with just ADD or ADHD without some depression, without some anxiety, without some other, as we said, the comorbid disorders. So you really have to take it case by case. But could the schools do something and not spend a fortune? Yes, but you have to remember that's not what the school model is based on.
Is it the
It's
school's
based.
responsibility?
I think so. I mean, the bottom line, as a lawyer, I can tell you here's the law. The school doesn't have to give you the Mercedes Benz education. It doesn't have to give you I better change the example to the Tesla education. It has to give you an adequate education. It doesn't have to give you the best. But yes, I think it's some responsibility to see that kids learn in different ways, like Monica was saying. But one thing I wanted to say to Monica is, but not every teacher does what she does. Not at some teachers still are strictly by, we don't have time. We can't cater to every different learning style. But I hope we get past that because I don't think that's the right strategy. And as to your point about small steps or micro steps, you've got to see the whole picture of the kid, as I said, and see what their learning style is. And that's not such a small task to start seeing what everybody's different learning style is. Again, you and I aren't in a classroom. We don't teach. We don't know what it's like to have, I don't know how many students. Some of the teachers have 20, 30 students. I'm
In one
sure
period.
right. And I'm sure some of them want to say, well, there's just simply not time to do it in so many different ways. But again, think about the self esteem. I go back to that kid, Tommy, who was in the desk, under the desk, hiding because he didn't want to admit he couldn't read or he couldn't focus. So we need to think about the cost to self esteem when kids aren't properly diagnosed, when they're made to feel if they're not doing it in this quote unquote traditional academic way, they're less than, because the cost to self esteem is enormous. It would be interesting. I don't know the statistics offhand of how many kids that get really depressed or suicide has some underlying learning disability or something that was undiagnosed. It would be interesting to know the statistics on that. But I know that the damage to self esteem when you're not diagnosed properly and made to feel that you're an inadequate learner, I know that that is devastating to a lot of young people.
So let me ask you this, and here's the big one. Especially in this day and age, when mom and dad have a cell phone, have an iPad, mom and dad want to do a podcast, they want to do their own projects, they need to feel that self-fulfillment, which as we all know takes time, right? If I know I'm going to be exhausted at 9 p.m., well, then I just want to get it done after dinner real quick. Now the kids are still up. I need to go downstairs in the basement and work on my project, or I need to study if I'm still in school or trying to build my education and get my master's and my doctorate, whatever the case may be. My kids are bouncing around upstairs. They have ADHD. That's it. They're bouncing around. I can't take it. I can't take it. Maybe they just fucking want my attention. How about that?
Oh no, we see that a lot. But they can't have the attention 24/7, right? So two things. Yes,
Agreed.
parents, right? So again, you're asking multiple questions. One, can parents be selfish? Absolutely. Do parents structure enough when they're exhausted? Of course not. But there has to be a balance. We talked in other shows about my favorite word is balance. The kids sometimes have to have quiet time, sometimes have to self regulate. And I should have maybe said in the beginning that a lot of these disorders are disorders of self regulation. You have to have the ability to self soothe, to entertain yourself. Mom and dad, if you teach a child that mom and dad are going to cater every minute to you, that's not going to be good. That's going to be a setup for a crash with reality in the future. So I think balance. If you say that there's nights that, these are nights that mommy and daddy have things to do, I think that's okay. That's
Can I
fine.
can I
But if,
stop you real quick?
yeah, sure.
So tell me what you think about this. So Jade, Jade is a 4 years old, as we know. Her brothers are one. Okay, so they can easily pull Monica and I in the other direction, right? So sometimes Monica and I need to be a little more conscious about where Jade is at. So yesterday, got Jade up, did her small group at school because she was still doing virtual, right? She was still doing virtual. She had a nice lunch. I played with her inside the house, took her to the park. Monica gets home. We have dinner. We get the boys bathed. Okay, mom. Okay, mom. Are we ready to go play? Now, here's what I think, and parents don't kill me. Everybody parents a different way. And mom, let's see what you think. I can't get angry. I can't get upset. I can't let her see any sort of discomfort from me that she inquired about wanting to play a bit more after we had just had such a nice day. So I feel it's very important, especially like I said, that's why I talked about the twins. I don't want her to feel like we don't have any time for her. I made the point to say, honey, we had a nice day. You went to school, we had lunch, we went to the playground, we're done for the day. Right. I listed all the things so that maybe she in her little brain can be like, oh, well, he's right. We did have a good day, went to the playground, things like that. Right. That's just a tactic that I use. I reiterate what we did that day. So it's like, Jade, I cannot play with you. No, it's not that I can't. I'm not going to play with you right now. I have some things I need to do. We had a good day. I love you. We'll regroup tomorrow. Explaining it. I'm somebody who always says that we don't give kids enough credit, whether they're 3 or 4. Like, they understand. Like, they have emotions, they have feelings, and she'll remember if I'm like, yo, I'm not doing this. So I just need to be like, Jade, we had a good day. We'll regroup tomorrow. What do you think about that as a psychologist and a parent?
No, I think that's fine to reiterate, but I want to pivot this situation a little bit to this. Is it go back to what I said about emotional regulation? And first of all, I want to ask you a question. So, how did you feel when she wanted more? Did you feel disappointed that she wasn't saying, "Oh, it was a great day," because you got years for her to do that. She's
every
4.
time every time in my head when she does it, I feel a quick second of guilt, and then I replay the day in my head. That's what I do. If I think to myself, you know what, I didn't really spend enough time with her today, I can do 15-20 minutes of that. I do that. But I try to make it a point to replay the day in my head.
So, parents out there listening, my best advice given to me when I was raising Ryan and Shauna was this: if you're looking for appreciation when they were 4 and 6, you got many, many years. It's going to start to come at about age 25. And guess what? That was pretty accurate. So, you got years for that. So, where I want to pivot you to is to ask Jade, hey, when it stops, whatever word she would understand it for. This is what I would ask if I was working with her. When it stops and you want more and there is no more, what can you do on your own? What can you do to accept it in children's words? That's the real issue, right? So whether you're 4 or 14 or 40, when you're having fun, you don't want it to stop. That's normal. That's not the problem. The problem is, what do you do when it stops? Do you have a fit? Some kids go on and on. She doesn't have a fit. I've seen her. How do you calm yourself down? And what do you do when you want something but time's out? Now, listen, for anybody who's listening, when I took Ryan and Shauna to Burger King or wherever it was to the playground, and I had an hour break at lunch, and I would take them, they didn't want to leave. Do you remember that?
Of course.
Those kids, they tortured me because they wouldn't come down from the wherever they were from the sliding thing, and you wanted more and more and more. You didn't say, "Hey, mom, it's great that you picked me up on your break, schlepped me to Burger King, and gave me 40 minutes." You didn't say that. You two had a fit and wanted more and more and more. And I probably wasn't that good at the time to say, well, what do you do? That I know now to say, hey, what do you do when you want more but you can't have it? So now you'll be ahead of the game. So you and Monica will think about that with the kids, right? And that's what I'm saying about looking at these diagnoses. In general, all of these diagnoses, we call them now spectrum disorders. Where are you? And I want to save a few minutes to talk about autism and missing autism in Hispanic and Black kids, and why that's happening and what we can do to raise awareness about that. But in general, all of these disorders have some rigidity to them. What did I say? That they can't self regulate. So, switching activities with an ADD kid or an autistic kid, this is not the kid to say, hey, plans changed. You got 3 minutes, sneakers on, let's go. So, I don't know if any of the parents have found that out there, but there's a rigidity and a structure that they adhere to, and they don't do so well with change. So, now that we know that, right, I tell parents, you got to create some situations artificially that force them to do okay with change. Does that make sense? Because we know
Yeah.
that they are
You're
some
training them.
disorders. Exactly. They are some disorders of rigidity. And you can speak to that. You still like your same routines, don't you? Ever since
Yeah.
you were a kid, you like your same routines.
I get sick if I feel like my routine's like not like vomiting, but like I feel like my whole day is thrown off if something I didn't get to do or something's out of whack. So yes, to this day I still try to adhere to routine.
Right. So now you can think about that when your own daughter wants that routine to go on and on and on. You can think about how she feels and how you're going to help her to cope with that. Right.
Yes.
And make it easier for her. I did want to save a few minutes to say, in preparation for this, I found some statistics that were disturbing. So we're still not where we need to be. For autism, which is the most serious of all the disorders, and autism has a lot of comorbids with it. For autism, there are, I believe it's a third of kids with autism have some intellectual disability also. So these are the more serious. So it starts like this: ADD. You think about a continuum. ADD is the mildest. Then we move into ADHD. We're not supposed to say it anymore, but then it went to Asperger's, which was a kind of a milder form, if you will, of autism. And then the most serious one, autism, which can have, I believe, 40% of autistic kids, unfortunately, are nonverbal kids. So, what I saw was that in the Hispanic culture, we're still not diagnosing them. They're underdiagnosed. And I wonder, and again, not to keep relying on Monica, but she does have a degree in Spanish teaching. Is that a language problem? That was the first thing I thought. Well, is that some language problem between the parents and the schools? Or where is the breakdown? Are the parents not bringing the right things to the school? In terms of Black youth, we're catching up and diagnosing them more frequently, but not early enough. And here was a sad statistic I found. When a Black kid is presenting maybe for social services or something like that, they've been written up so many times for behavioral problems that really was maybe an underlying ADHD issue. But now the social worker or whoever's working with them, somebody at the hospital, sees all these quote unquote behavioral issues and misses the diagnosis. So we still have some work to do. But I do believe that some of the breakdown is between the interface between the school and the parents. Many years ago, when you were just a young toddler, I was on the Women's Democratic Committee trying to get a grant, a program to go out to the minority schools and teach, hey, these are the things to look for. These are the things to bring to the school's attention. Under the law, this is what your kid's entitled to. We came very close to getting that grant. It was actually with Mrs. Clinton, but we missed it by a few points and didn't get that grant. But everybody thought it was a great idea to empower the minority parents and teach them what to educate them, what you're entitled to get for your kids in terms of programming. And they're unfortunately sometimes not the most demanding population. Like if you go into white suburbia and the parents are somewhat demanding about what to get for their kids. So we still have a way to go because there's too much discrepancy and too much delay in diagnosis on the autism end, or autistic scale with minority students. And I don't know if Monica can help us
Yeah.
out with
So
the
so
Spanish speaking kids.
I'm gonna list her two statements, and then I do want to move into to the subject of autism, and we're probably going to go over the hour mark a little bit, but that's okay because we want to give this topic and these topics the attention they deserve. So first up, it's cultural. It's a misunderstanding of the American school system. It's the learning gaps between their schooling in home country versus the expectations here. Following comment: I do a large amount of advocacy on this topic with my ELLs. So to I don't want to speak for her, but I want to, if I remember correctly. So when she says advocate, when the child is integrating into the middle school and Monica's going to be working with them, English is not the first language, and there's still quite a barrier there, quite a gap there as far as language. It can it can, like you said, to put it simply, it can be missed, right? And it's like, okay, so how do I communicate this? Like she just said, there's one school system where my mom grew up, and then now I'm here in the United States, and it's a completely different school system. So there's that whole gap, And then we have attentive, caring teachers like Monica and her peers who do a great job of working a little closer with these students, a little more one-on-one, talking after hours about these students. They really care about their well-being and they want to see them all do well. So I know that Monica and her peers do a great job of closing that gap and helping the students successfully migrate into college or the next chapter of their lives. So if you're listening, especially my wife, great job. I know we're always talking about that. I know where her heart is. So yes, to answer your question, like you're saying, it's cultural. Per Monica, who has been doing this for 13 years, I believe. When it comes to Hispanics, she's saying it's cultural. It's a misunderstanding of the American school system. It's the learning gaps between their schooling in home country versus the expectations here. So there's what my wife, who is a Espanol teacher and is what does she have? Her certificate, ESL, English as a second language. So she does a lot with English as a second language, primarily working with I think Guatemalans and or young ladies and young gentlemen from Guatemala. So yes, that's pretty much what she does in addition to her regular duties. So
And do you want,
go ahead. I know you want to say something.
yeah, I want you to tell everybody how I tried to get you to take Spanish, how your aunt tried to get you to take Spanish. You wouldn't listen. You took German. Then you called
Oh,
from
I
your
was
first.
listening. I just wasn't listening to you. I was listening to Rammstein. I was in a big German music phase at the time. So I was listening. I just didn't want to listen to you and my aunt. I wanted to try something else.
And what happened when your first job in a restaurant? He said, nobody's speaking German here. You
Uh,
guys,
if you're listening, and I don't know if anybody I've ever worked with is listening right now, the amount of people who I have disappointed in my life who came up to me and started speaking Espanol with the hopes that I would be able to understand them, I have to stop them. I go, sorry, no habla español. We just had, we have a crew, an outside crew at the hotel helping us finish things up. So they're staying there. And my first interaction with one of the gentlemen, he says, habla español. I say, no habla español. And he goes like this, but you're Espanol. I'm like, I'm Espanol, but, and then I have to, I have to say, yeah, I'm adopted. I was adopted at birth. My parents didn't speak Espanol, so I didn't grow up in a Spanish household. But then I always say, mi amor, habla español, my wife who speaks Spanish. So real quick, like I said, now we're at the 52-minute mark, and here's what I want to say as we head into the topic of autism. I know a young man who I worked with, good, like 10 years ago now. He was on the autism spectrum. He told us about it. He graduated high school. He graduated from Temple University. He had an honorable discharge from the United States military, and he is now a sheriff's deputy. And he is on the autism spectrum. So I want to actually hold on real quick. We have another comment here. Let's jump to this real quick because I think it pertains to what we were saying. I think the minority parents are not being educated in the different programs out there. I've had to learn what's available out there for my children with ADD. I thought being diagnosed with this was a curse, but as I educated myself, let me see if I can read it because it's being cut off real quick. As I educated myself and asked questions, I learned the many blessings and doors that opened up for them. I think minorities need to get help in educating themselves to help their kids. What do you think about that?
that's what my grant was about. It's still painful so many years later that we didn't get it. Absolutely. Are the schools doing enough outreach, running some groups, teaching parents what they're entitled to? But you hit the caller hit on something really important, which is what the parent's mindset is. I think Monica hit on that too. Sometimes a bump that we have with the parents is for those kids who can't, as you said earlier, can't be programmed out of it by the parents who need some extra help. Some parents say this is nonsense. Everything in America is a label. It's a ADD. It's a bipolar. It's a this. It's a that. It's nonsense. The real diagnosis is BRAT. This country has a lot of BRATs in it. And so it's a mindset. Some you're laughing, but it's not so funny when you're in session and they're
I'm
telling
not
you this.
laughing. I'm laughing because I want to give you all the credit in the world for as much as you have annoyed me over the 32 years that I've been on this planet, even though I love you with all my heart. you and I have butt heads on the topic because I always said, discipline, sports, martial arts. Now I realize all these years later that that's not for everybody. Some kids want to play video games, some kids want to draw and make comic books, and that's awesome. But the point I'm trying to make is that you, with all your experience, and I would put your experience and knowledge up against anybody else in your field, and I imagine that you would hold your own and perhaps take them out and make them rethink every choice that they've ever made in their life. You're saying now that there are too many labels, so I respect that you, as a therapist with 40 years in the field, who's attained their law degree and has worked with children on all different platforms, you're saying that there is too many labels, and that's something that I think that we can definitely agree on at this point. But yes, as you were, I'm sorry.
No, and I think that's another show. I mean, I had families I've treated where they made 7, count them, 1, 2, 3, 4, 5, 6, 7 breakfasts for the kids. 7 breakfasts. That's not about ADD. That's about spoiling the kids and having them think that, hey, I don't want this one, I don't want that one. There's going to be 5 more choices. It's ridiculous. But I think that they're uh, honing in on a really important point, which is, does the parent have any prejudice? Can the parent really open up their eyes and say what I said at the beginning of the podcast, that for some percentage of kids, it's not parenting. It's not the kid being a brat. For some percentage, it is a real disability. And come on, let's be honest. We have a prejudice against mental health disabilities because we can't see it on an x-ray. Because I can't tell you there's a hairline fracture in the psyche. I can't tell you that. I can't say you need to cast the psyche. Here's the treatment. In 6 or 8 weeks, it's going to heal. And God forbid, when they're mental health and these kind of disorders, they're for life. We don't like that as a society. We like our medicine quick and to be a fix. We like to know that, hey, that right pain's appendicitis. Let's get that appendix out, and you're going to be all fixed up in 2 weeks. So we do have an underlying prejudice. And here's the big question that you touched on, which is how much of this is volitional when it comes to depression, anxiety, ADD, autism. Hey, how much of this is under the person's control? And that's where the problem starts, and that's where the prejudice starts. You don't ask a cancer patient how much is under your control. I was diagnosed with breast cancer 4 years ago. Nobody said, hey, you brought that on. Hey, you can think your way out of the breast cancer. Hey, just get up, and you don't need the surgery. You don't need treatment. You can just do this on your own. That would be ludicrous, right? Nobody's going to say that. But when it comes to behavioral and mental health disorders, let's be honest, whether it's a parent, a sibling, a husband, a wife, we're always thinking, hey, could they do better? Is this a real disorder, or could they do better? The last few things, we're going to have to do another show on autism, but I think that one of the heartbreak diagnoses is the high functioning autistic person who really was never diagnosed.
Oh, can
And
I say
so,
something real quick?
of course,
Yeah, so we are running out of time here on this very first episode. So just so everybody knows, it sounds like we have picked out the next topic for our next episode, which will be about autism. ADD and ADHD are taking up the majority of this episode, which is perfectly fine because we want to give it the attention it deserves. So leading into the next episode at the 58-minute mark, I just told you about a young gentleman who I know and or knew and still know. Went to high school, graduated, went to Temple University, went to the military. He was a sergeant, I believe. He was in a position of leadership, honorably got discharged from the military. He's a sheriff's deputy. When I tell Monica about things that I've learned about Steve Jobs, he was easily perhaps the biggest innovator of our time. If anybody ever reads the books or reads a couple books, he has done so much for marketing, for branding, for technology, for us as a society. Steve Jobs was a legend. Elon Musk. Okay. When I tell Monica what I've learned about them, the first thing she says, and it's not in a bad way, it's just she feels that they might be on the spectrum in some way because they need things to be perfect. They need to execute this idea. They can't stop thinking about it. And also the behavior towards people, which may be a little more aggressive and judgmental at times, could be something that's on the spectrum. So what do you think about that? Successful people we're naming here.
no, I think if you did, I think it's absolutely right. I bet if you looked at all the presidents, come on, you don't think Bill Clinton had ADHD? A lot of impulsivity. Who would want that job? Like I said before. So I think this is what I want to finish with. Your point exactly. Let's not let's worry about the label. As a lawyer, I'll say, well, let's worry about the label, to be blunt, to get what we can for the young person. Remember what I said about the bar? I needed some extra time. So let's get what they can to make them the most successful, absolutely. And then after that, let's not look at people so much as labels. At the end of the day, here's what I think. You say, Feinstein, what do you think after 40 years of being out in the field? I think everybody on some days has a little autism. I think everybody on some days has a little ADD. On some days, everybody's inattentive. We all have a little bit of it. We have to worry a little bit less about the label and go like this. What makes this child or this person the best? That's what you've been saying. You've been saying, what are the best conditions? And I would ask everybody who wrote in about the martial arts to tear it apart a little bit. What is martial arts? It's taking all that energy and channeling it in a positive way. You know the number one occupation for ADD and ADHD? ER. ER nurses, ER doctors. What a beautiful example. Here's the deal when you work in the ER. You don't have to have a long-term relationship, because we know that people with ADD and ADHD, they get bored with things. They have some social issues. So you don't have to have a long-term relationship with the patient. You got a lot of excitement, and you got to switch it up and change it up and know different skills. So that's people who took what the way their brain worked and functioned and put it to a good use and cause. So I think at the end of the day, the admission that we all have some of that in us, and really to start thinking about what's the best context and best environment for us to work in, and drop the judgment about it. So that's what I think. Most days, when I used to say leave my office, now when I say leave my video or Zoom or whatever I'm doing the sessions on, that's what I think. I think we all have some of it in us, and making the best match between our personality, our brain functioning, and our environment. That's the name of the game, whether it's in the school or the adult life. And I think that's what you're saying. These guys, but those guys that you're mentioning, Ryan, wouldn't have been good in a 9 to 5 regular job, probably,
No, they would
right?
have hated it.
No, they wouldn't have worked, right? So it's the match between personality, temperament, motivation, and the environment you put yourself in. Yes, absolutely. I agree with you.
Excellent. I think that's great. And I think that's great for a very first episode. So at the 1 hour and 2 minute mark, my mom and I didn't get into an argument and just shut off our screens. No, I'm just kidding. So my mom and I, we have a very, very beautiful, 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 complicated relationship. But here we are. So we're going to make this podcast happen. This is her show. She is Dr. Mom. She's a therapist, a lawyer, and a mom. So today's topics, we did ADD, ADHD. We wanted to try and touch on autism and try to integrate it to the conversation, but we stuck with ADHD and ADD, and I think that's a very good place for us to stick for the first episode. Next episode, we will talk about autism, and we will go in depth just like we did here today. So, Mom, congratulations on your very first episode. You made it,
Thank you.
and we will see everybody next time.
And not only mom, but grandma. Mama also.
Mom
Don't
and
forget
grandmom too. All right,
mama and grandma.
everybody. Thank you for tuning in. Mom, say bye to everybody.
Goodbye. Love to you. Love to Monica, and love to the kids.
Love you too. We'll see everybody next time.